So this is a heart catheterization. I'm going to show you the blockage that you had.
At University of Iowa Hospitals and Clinics in Iowa City, heart surgeon Dr. Mohammed Bashir shows me videos from my cardiac catheterization. Videos used to determine that I needed quadruple bypass heart surgery right away.
The main culprit is this vessel down here. There's a little narrowing down here as well.
Somewhere along the line, and doctors really don't know when it happened, I suffered a non-STEMI myocardial infarction, also known as a mild heart attack.
See the heart muscle squeezing there. That means that all the muscle is moving fine. There's no damage to the muscle of the heart.
I had none of the classic heart attack symptoms like chest pain, but doctors found that I had 4 major blockages in my heart vessels.
You can see that blockage down there as well.
Dr. Bashir has performed about 1,000 open heart surgeries, and as he did for me, helping patients is his passion.
Primary prevention is the key here. Basically you want to get at the disease before it even develops. And we know that this problem of blockages in the heart vessels is related to certain dietary habits or sometimes genetics. Now this is the left side.
Over several years, unbeknownst to me, plaque began to build up in my arteries, much like you see in this animation.
If I pause it here, you see how this is irregular, but there's a narrowing right there. You can see this. See that area of narrowing right there?
Open heart surgery had become a necessity for me, and I was sent right from Covenant Medical Center in Waterloo to University of Iowa Hospitals and Clinics in Iowa City.
I appreciate everybody here.
For me and so many others, like John Creelman of Oakville, one of Dr. Bashir's patients, there's no turning back at this point because we risk having a sudden fatal heart attack, often called the widowmaker.
Once you know about it, then you have to act to prevent that, because that's the whole purpose of what we do, is prevention and protection of the heart. And if once we know that, we had to do something about it. You cannot let it go. These are the arteries, these are the veins. We bypass the arteries, obviously.
This animation shows how doctors graft a vein or artery to the aorta and then graft the other end to an artery just below the blockage, thus bypassing that portion of the blocked artery. During an open heart surgery like this one, and during mine, doctors break the chest bone or sternum and then pull the ribs apart so they can work on the heart. The heart is actually stopped during the operation and the patient is put on a heart and lung machine.
I would say the recovery for the most part after open heart surgery is related to the bone itself and the incision and the trauma to the body. So it's basically like being involved in a motor vehicle accident, but it's a very controlled accident or a trauma to the heart or in the body.
Following the operation, the recovery period is about 12 weeks.
So we did 4 bypasses for you, and then we closed that hole in the heart as well. See how this floppy septum?
That was another shock for me. Turns out since birth I had had a ventricular septal defect, a birth defect commonly known as a hole in the heart. You can see it in this video, but it never caused me any problems even during sports. These blockages were a complete surprise to me since I've always exercised and run, including 10 marathons and countless other races.
A little bit of leakage in the mitral valve.
Since I have no risk factors, it's pretty likely that my artery problems are a result of my love of sugar and pop. They have to go.
So what do we learn from a case like mine? I've had so many people say, I was shocked that you had a heart attack, and what should I do as an individual to get my baseline for my health?
The biggest thing that you can do for yourself as anybody or as an individual is basically to eat right, exercise, have a physician, if you're prescribed medications, to stay on them, and really take things seriously if you notice some warning signs of your body with symptoms. And the most important thing is to have a physician that you see on a regular basis that can monitor things for you. And I think that's key. And if you have that, that's more than half the battle. And always have a primary physician that you can go to every time and they can regularly check your health. I think this is the best thing that people can do.
The cardiac rehab nurses at Covenant continue to help me with my recovery, and a recent trip to Iowa City gave me a chance to thank some of the nurses there, like Zach, whose grandparents live in Waterloo, and Katie and her colleagues, who took such great care of me during my stay in Iowa City.